very broadly, it's been going on in the hospital industry. What we're seeing now is hospitals in a particular area acquiring or partnering with the other hospitals surrounding them. And so you see these regional hospital powers really developing in a lot of areas.
An IDN is an integrated delivery network, and it can mean a lot of things, but basically what you're looking at is a set of physicians working with hospitals to form basically an ecosystem is the way we look at it, and a place where they can look at a patient holistically, not just going in to get a procedure, but how do we take care of this person with preventive care and post-discharge care? How do you look at the whole health of a person? The goal of the IDN really is patient containment. The idea that a patient does not have to leave that particular ecosystem to get care.
It's important to keep track of these mergers because it could influence what doctors you see or where you get your care delivered from. So it really impacts every aspect of the healthcare ecosystem.
Ultimately, exchanges cover basically the portion of the population that's had trouble getting insurance in the past, buys their coverage. And because of the way the ACA was structured, it was the only place where people below certain incomes could get cost-sharing help with their exchange premiums, which is a very important piece because health insurance premiums vary from state to state and market to market, and some places they can be very expensive. So the exchanges are geared towards individual states, and they're not one size fits all. If you've seen one exchange, you've seen one exchange. Most states have a federally facilitated exchange, which means they don't really have a say in the exchange. It's run by the federal government through healthcare.gov, the federal website for that. There's a handful of hybrid exchanges which the state retains some control, and they use healthcare.gov as well. And then the remainder are predominantly state-run exchanges where the state has control of both the website and the regulations.
Insurers that are invested in the Medicaid side of the business, it's going to become a more complex kind of a business for them because each state is going to be developing its own rules about what it wants its waiver requirements to be. They may be trimming back benefits in different ways where there used to be a lot more uniformity of benefits. And so that kind of adds to the internal expense, and they'll probably have a greater difficulty in just knowing whether people are in or out of the program at a given time. One of the good things about the way we're structured here at DRG is that we do have products that really focus at the market level, where you see a lot of those hospital systems coalescing and really becoming powerful and really reshaping healthcare at the community level. And we also have a state view. We have products at the state view. So we can really kind of balance what the national trends are versus what's happening at the state and the local level, all of which are feeding into the same thing, but they're very, very specific community to community and state to state.